Member for Kew.
Thank you very much, Acting Speaker. And I too rise to probably what will be a brief contribution because my lung capacity seems to be limited by the day at the moment, but to make a brief contribution on the Health Legislation Amendment Regulatory Reform Bill 2024. And can I echo the comments from the member for Cranbourne about the powerful speeches that have been made today on this piece of legislation. It can be a very difficult discussion and difficult process talking about what can be very personal fertility journeys, and I think having a number of members share their own only helps others who are going through that difficult journey understand that there are others out there going through that experience and there is support available. Acting Speaker, this legislation before us today will make a number of amendments to the regulatory frameworks to essentially modernise, streamline and look at the compliance and enforcement powers around health regulation in the state and particularly by the Department of Health's regulator, and look at making sure that our regulation that supports our health system and the Department of Health is minimising risk and promoting health and safety for all Victorians. And it does come off the back of the Gorton Review, which looked into assisted reproductive treatment. And it proposes changes to enhance compliance and enforcement tools across a number of pieces of health regulation and a number of schemes, including, as the member for before me, Morwell, the wonderful member for Morwell, who's going to do a lot of babysitting, so I should not forget that. As we pass the babies around the chamber, as the member for Morwell said and went into great detail about, and a good understanding for all of us around cooling towers under the Public Health and Wellbeing Act, the drinking water under the Safe Drinking Water Act, the first aid services under the Non-Emergency Patient Transport and First Aid Services Act, the non-emergency patient transport under the Non-Emergency Patient Transport and First Aid Services Act, pest control operations under the Public Health and Wellbeing Act, private hospitals, day procedure centres and mobile services under the Health Services Act, medicines and poisons under the Drugs, Poison and Controlled Substance Act, and radiation sources under the Radiation Act. And all of those consequential amendments under this piece of legislation will look at strengthening the regulation of our health system and ensuring that we are minimising risk for Victorians. But as has been spoken about at length today, Acting Speaker, the bill does see the abolition of VARTA and the transfer of its responsibilities of regulation of assisted reproductive treatment. And we know the current functions of VARTA include the registration of assisted reproductive treatment providers and monitor of compliance, management of the registers that hold donor conception information in Victoria, essentially the central register, including providing counselling to people who seek to access and store information on those registers, and consideration of applications to bring donated embryos from them into and out of Victoria. And importantly, and something that I know that a number of stakeholders have pointed to in the drafting of this bill and making sure that this continues post the introduction of this legislation, but public education and promoting research about fertility and reproductive services here in Victoria. On this side of the House, while we will not be opposing the bill before us today, we do note a number of concerns with the drafting and just want to ensure that we are putting forward legislation that does at all points in time minimise risk and promote the health and safety of all Victorians. And particularly the need for specialist expertise and whether the Health Department will maintain the level of knowledge and expertise in this complex area that has been previously provided by VARTA and I know has been extremely valued over the course of the existence of VARTA. There's also concerns around removing mandatory counselling for donor register access. People accessing donor information are very vulnerable and may face unexpected and confronting information, such as discovering the parent or child has passed away, has criminal convictions, mental health issues, and there is a need for adequate support in that space. And I know that stakeholders have stressed the need for specialised counselling to safeguard individuals' wellbeing in this space, and that counselling remain mandatory for treatment of donor consent. And in particular, we've heard in our own work, and can I commend the member in the other place, the Shadow Minister for Health, for her immense work on working with stakeholders in consulting on this bill. But when speaking to Monash IVF, they certainly shared their concerns around mandatory counselling for donor registers, and particularly around opposing the removal of that mandatory counselling, highlighting the importance of counselling in managing the identity, importantly the expectations and the relationships for those accessing donor registers. And they are, on the record pointing to the potential psychological harm, trauma, without that proper support. So we do want to see, and as part of the work that the Shadow Minister for Health has done, and as part of her proposal around a review when it comes to looking at this legislation in a few years' time, ensuring that that counselling does remain available, that it does form part of the new role that the Department of Health will have when it comes to administering the reproductive and IVF services here in Victoria, to make sure that we are putting forward the support for those accessing donor information in particular. The other concern that we have spoken about and that we on this side of the House have is the removal of the legislative requirement for research and education in this bill. Previously, there were requirements as part of the legislation that there would be access to reliable, independent information on current research about infertility and donor conception. And the change with this piece of legislation, Acting Speaker, is that's no longer a legislative requirement under the bill. The government has said that they're committed to providing that ongoing service. It's been acknowledged the role that VADA has had previously in providing that service to ensure that, particularly that independent information is available when trying to make important decisions in this very specialised area of care. And we want to make sure that those educational resources do not cease without that legislative framework sitting around it. So that's something that, once again, Monash IVS have expressed their concerns about, and just expressed their disappointment that that ongoing role of VADA's educational role will not be replicated in this piece of legislation before us today. And calling on the government to not only commit more broadly to providing that education and ensuring that that's available and accessible into the future, but outlining their clear plan to do so, continuing to provide that reliable and independent fertility information that so many Victorians have relied on in the past and should be able to rely on into the future. Acting Speaker, the opposition has a range of other concerns with the piece of legislation before us, including the lack of clarity on the future of the data being published by VADA in its annual report, and just the process by which the public consultation took place. It was indeed a very short time, limited to written submissions only, and not making those submissions publicly available to ensure that stakeholders who work every day in this space, who are experts in this space, are actually able to put that feedback on the record to ensure that the bill before us today is fit for purpose and is meeting the expectation not only of the Victorian community but of those stakeholders who work in it every single day. Acting Speaker, as I said, the opposition will not be opposing this bill. It does seek to put in place a number of regulatory changes and streamline a number of regulatory changes in the health system, and I thank you for the opportunity to speak on it today.